Welcome to Happiness on Tap podcast, where guests dive deep into the vulnerable experiences that contribute to their happiness. I'm Leanne Herron, certified health and life coach, owner of Finding Resilience with Leanne, and creator and host of this podcast. This episode is part of our health and wellness series. Thank you for joining us for Regenerative Medicine with a Heart with Jeannett Martinez, certified nurse practitioner and co-owner of the New Mexico Spirit of Wellness. Hi, Jeannett. Thank you for joining me. How are you today?
Hi, Leanne. Thank you for the invitation. I'm doing well.
You look very lovely. I love the red. Power color.
Thank you.
So Jeannett is a board-certified nurse practitioner who is focused on bringing medicine back to a more intimate setting to find the most appropriate healing modalities unique to each person. She is a member of the American Holistic Nurse Association, American Academy for Anti-Aging Medicine, International Society for Stem Cell Application, Empire Medical and Cellular Medicine Association, and independent provider for both Western and integrated medicine practices. She started her career in medicine at Presbyterian Hospital in Albuquerque, New Mexico. Her work experience combines 10 years of inpatient hospital medicine and emergency room medicine. Next, she worked in rural medicine in primary care and urgent care for 2 years. From May of 2020 to February of 2021, she took COVID assignments through the New Mexico Department of Health Medical Reserve Corp to help the Navajo Nation in Gallup and Albuquerque, New Mexico. She learned a lot from each place of employment and met wonderful people. But more importantly, she learned that she wanted to have more time to spend listening and treating people when they come looking for her help. So tell us a little about what you do and how people can benefit from your services.
Well, I think it's really kind of awesome to have a medical degree. I get to explore many different types of healing modalities, and I really appreciate having the medical background to be able to order imaging, blood work, medications if we need it, understand how to use supplements in place of medications when it's safe. And most of the time, if we do a lot of these interventions earlier, we can help preserve our body functions before we even need to think about pharmaceuticals, and often avoiding pharmaceuticals.
Oh man, that's wonderful. So Happiness on Tap's mission is to provide value to our listeners by providing tips and tools to help people realize that they are not alone, while providing education and information to help them improve their daily life and health, cope better with life's changes, reduce stress, and become their best, most authentic version of themselves. Jeannett and I met briefly with a group and then began getting to know each other as a potential referral partner. I went and met her at her beautiful office in downtown Albuquerque, and I was so intrigued with all of the services that they offer that I wanted to invite her here to share them with you. So, Jeannett, can you explain what regenerative medicine is and how it differs from traditional medical approaches?
Sure. So I think traditional medicine, is more in the context of talking about insurance type medicine. And insurance type medicine has its main goal of using pharmaceuticals and surgery as main interventions. Pharmaceuticals are designed to help diseased tissue work longer and harder. And surgical interventions, their goal is to remove or alter whatever ailment or body part is ailing for the benefit and recovery of the subject. And regenerative medicine has a different approach. It proposes, what if we help stimulate restoration to the body parts that are ailing us? So it helps, instead of helping diseased tissue work longer, its goal is to help restore normal function to the part that is causing us trouble. And in our bodies, we always have a trickle down effect, right? There's more than one talent to that tissue that is becoming sick or tired. It plays this giant role in our body. So if we are able to preserve function to that particular piece of tissue, then our body has this full-blown effect of benefit instead of a slow deteriorating process because we focus on one area.
Could you give me like one little example of what that might be?
Boy, there's a lot of examples. I like to use sexual wellness as a great example because what's good for your sex life is good for your heart, is good for your brain, it's good for your mental health. So in treating sexual dysfunction in both men and women, we run extensive blood work to see, nutrition, inflammatory markers, hormone markers, and it's not just the sex hormones. It's our adrenal hormones, our thyroid, and our sex hormones. All of these hormones play something very similar roles to each other in the body. So when we can help and fix, restore function in multiple different areas of our body, that in turn gives you an improved sex life. So everybody thinks that you just need a pill, right? Viagra or Cialis for men, and women can also take the same, or just, lubrication for a woman when there's so much more that goes on. The first sign of having a dysfunction as far as sexual wellness goes is actually a full-blown body crisis. So addressing the body helps that one problem.
And that makes absolute sense. This whole body medical approach, when you're looking at like the benefits of sleep and how it affects your cognition and how it, everything. We are all one big giant organism that needs, catering to. And, if you're only putting a Band-Aid on one problem, you're not fixing anything.
I agree. And sleep, also in insurance medicine, they'll give you a medication to help induce sleep and hope that will solve the issue. But you're right. I mean, when you don't get restful sleep, your body can't regenerate. You get high blood pressure, your adrenal hormones go in the toilet, your mental health goes in the toilet, your energy level, fatigue, weight comes on. There's so many things that come from just lack of sleep. And if you can find the pattern to treat in a general wellness and regenerative thought process, then not only have we avoided sleeping medication, but we have helped the body restore itself during its restful time.
Mm-hmm. And I think a lot too is getting to like the causes of why they're having problems with their sleep, whether it's medications, whether it's excess weight, stress hormones, like you said. If we can get back into a rest and relaxed state, our body can rejuvenate. But you have to look at all those factors, not just here, let me give you a pill, or let's put you on a CPAP machine to help you, sleep, instead of consulting with the patient to have a change of lifestyle, or, it's just, yeah. That
It's
kind of
true.
medicine.
No, it's true. And you're right. Everybody is just a little bit different. So not one size fits all for the treatment plan.
So, what inspired you to specialize in regenerative medicine?
Well, that's my own body. I am not a very hardy specimen of a human either. So I had two hip surgeries and I went through menopause in my mid 30s. I didn't have a surgical reason for menopause. My body just one day went kaput, and I had the hardest time recovering from my two hip surgeries. And then on top of that, onset of menopause, it was really kind of an overwhelming full body failure. And I work in the medical field, and I did want very much to recover. So I went through everything that was given to me by my medical providers, which were also my colleagues and some of them were my friends, to find the road to recovery. But it didn't work for me. After two hip surgeries, I had the hardest time moving again. And I had more pain post surgery than I did prior to surgery. And I went from a functioning human who used to be able to ride my bike, hike, mountain climb, run, to barely able to just, function at work, mobility wise.
Mm-hmm.
The orthopedic surgeon just had steroids, injections to give me more surgery, physical therapy. I did physical therapy total for almost about 4 years,
Wow.
acupuncture, chiropractor, massage therapy. And at one point, they even sent me to the pain clinic. And I didn't want to go to the pain clinic, but I felt like I was starting to get the non-compliant vibe from everybody, even though I
Mm-hmm.
was trying my hardest to comply to everything. Nothing made sense to me, and so why I couldn't recover, and it didn't make sense to them. And when it doesn't make sense to them, then they start telling each other that this is all in our head, right? That this is all in the patient's head. And I could tell that they were thinking of me in the same way. And I actually started to wonder myself, is this all in my head? Could I be doing this to myself? Why would I do this to myself? And
Mm-hmm.
that sent me down a different
Rabbit
sad
hole.
moment of trying to decide if I was really truly self-sabotaging myself. So when I failed everything my medicine had to offer, I had to look for other ways because I knew I could be okay. I should be okay. I could be okay if I could figure out what the actual problem was. So regenerative medicine gave me that gave me that recovery. I had to find it, understand how to tailor it to my body. And when I started moving, when my pain started to get under control, and it all made logical sense. It wasn't in my head. It was a physical reaction to all the physical offenses that my body went through.
Mm-hmm.
It was fantastic to know that I wasn't self-sabotaging. None of us were just listening to my body.
And that, it makes a lot of sense. I went through that as well with my ex-husband. He was not a surgical candidate, had a lot of pain in his back and inflammation. And after he had went through all his available services for chiropractic and massage and all of those things, then it was just pain management. And it ended up being, pain management that created an addict, because that's all they would do was continue to prescribe opiates. And never, and after a certain amount of time, we found out that his medical records were showing the same thing as yours. They made it sound like it was all in his head. He was just over exaggerating.
Yeah,
Um,
I think I was sharing with you. I feel terrible for anybody who has to go to the pain clinic. I'll be very honest. I feel like it's when they send you to the pain clinic, it's because nobody believes in you anymore. They don't believe they can recover. They don't believe you can recover. They don't believe you as a human being. And that was my experience as well. I didn't want to go. And when I did go because I didn't want to become the non-compliant argumentative person that I was becoming in my own medical community. And the provider that I saw, she definitely gave me this overwhelmingly disenchanted feeling. And so when I left there that day, because I didn't want to start on like narcotics, but I'm like, what else are they going to offer me? Nerve ablations, and I felt like I don't really want a nerve ablation. I want to know why my body's in pain. I don't want to mute the voice in my body
Mm-hmm.
that's telling me I'm not okay. And so I left there, and then it's illegal to do. You're not supposed to do it. If you work in the medical community, you're not supposed to tap into your own medical records. You have to go through requesting them from the uh, medical records room. But I left there feeling really uneasy. So of course I logged in to see what she wrote about me. And she wrote that I had drug seeking tendencies. I wasn't doing anything to help myself. And basically she just kind of trashed my character so she didn't have to do anything to help me. So
Mm-hmm.
anybody else who's going to read that didn't have to worry about listening to my story, trying to interpret, the signs that I'm trying to tell them how to interpret it. It was just going to be just like your husband, a closed case, or ex-husband, a closed case that, these people are not trying to help themselves and we can't help them either. So I was so furious. I printed it out. I knew I was going to get in trouble. I printed out the record. Then I went to the gym I was going to Define Fitness at the time. I would go there 3 days a week. So I had them print out. I did this for years. Even when I wasn't well, I was always going to be doing what I was supposed to be doing.
Mm-hmm.
So I printed out my clocked in times, from my visit times at Define Fitness. I printed out all of my physical therapy reports, and my attendance sheet there. I went to the chiropractor and asked for my, 3 years of my
Yeah, to show you
invoices.
were in
Yep.
compliance.
And then I went to the medical director and I complained and I showed them everything. And of course, I got in trouble. So then they had to have and I knew that I would, but I wanted them to know that you can't write these terrible things about me and then think it's going to be okay. So then they had a huge meeting, and of course, you're right, Leanne. They can't take it out of my medical record, so she had to write an addendum to it saying, everything that I had originally told her that I was saying, and using all the evidence that I brought in there. But that's not going to be the first thing they would see if they opened it up. They would
Mm-hmm.
see the original report, and underneath they would see what I made them write, which is the truth.
Mm-hmm. Yeah, I'm familiar with that from a personal perspective and a professional perspective, working in the legal field. And I was responsible for reviewing people's medical records. And, you would see those things and then you would talk to the client and they were like, what? Wait, why? What is that? And then they'd look at their medical record and it was completely the opposite of what they knew to be true from their providers or just how they felt. And, yeah, they would go back and try to have those records removed and no, yeah, it just wasn't happening. So I understand
And
your frustration there. And that is horrible it's like you said, attacking your character.
it's so, I feel like it's just, it's so demeaning to do this to human beings, right? And I'll tell you, in the whole time that I've been in medicine, I've never seen somebody and thought they weren't telling me the truth. Even somebody who is having, questionable memory or character, there's truth to what they're telling me. And so trying to figure out what the situation really is to help somebody is so important, because so many people are just dropped through the system. I mean, they turn to so many different self-medicating things because nobody listened to them, or they start suffering so much. I mean, I thought I was going crazy for a while with how I started to think, why am I in so much pain? Why am I feeling? So people, I mean, it starts to affect their psyche and their relationships, their general health. I mean, so many things happen when you just don't listen to somebody. Part of listening to their story is kind of validating their life experience and who they really are. and then you can get to treating the body, but you have to listen first.
Absolutely. Listen more and talk less.
Right.
So what are some other common conditions that can, or injuries that can benefit from regenerative medicine treatments?
So, boy, I honestly, most injuries do really well. I do really good. Frozen shoulder works really good. I'm like, I can unfreeze it. We can get it moving again. So shoulder injuries do really well. Necks do really well. Back pain I'm pretty successful with that. Low back pain, middle back pain. Um, Sciatic pain, I love treating sciatic pain because sciatic pain is so miserable. And I can usually just in one treatment get your sciatic pain, 60, 70% better, if not 100% all the way. So it's quick and instant relief. Sometimes you need another round or two, but it's so easy. Hips do really well. Knees do pretty good too. So muscle strain, I don't know. I'm like, most injuries do very well. Treated arthritic hands, fingers, hands, wrists. They all do pretty good.
Wow, that's great. I think I have a few people in mind that I'm already thinking. I have somebody that just recently said that they were looking at having to have carpal tunnel surgery. And yeah, it's been since I was a kid, and I saw what happened to like one of my mom's friends who had carpal tunnel surgery, like probably back in the late 70s, early 80s, and just watched her hands just cripple. And I that's the image that stuck with me. So now seeing people now who are like, oh, I may have to have carpal tunnel surgery, I cringe. I'm like, oh no. So hearing that there's alternatives.
Absolutely. I always do a good workup, find out blood work. It's the same workup for everybody. We run 22 different labs for women and 24 for men because we don't have to check a woman's prostate. So 24 for men, and imaging of the affected area. If it's a pain consultation, have to know the integrity of the tissue that we're dealing with, so we can have realistic conversations about what's possible and what's impossible and what's probable. A lot of times we can get pain completely under control and have a little bit of dysfunction left in the joint moving because there might not be as much because of the degeneration process for it. But I'm about 65%, running about 65%. I'm not 100%, but when I was looking for help, I was about 40% functioning. Mm-hmm. And so I struggle with the idea that I may never run again, and I just had Achilles tendon surgery for some bone spurs in my Achilles tendon. So I'm recovering with that. We used some stem cells and peptides. So still kind of recovering, doing a quicker recovery. But, my body's been a little bit difficult. So I feel like some people, I'll prepare them for the kind of recovery that I've had, and they'll make 100% recovery. Some people will make, 70% recovery. But I feel like at 65%, for me, at least I can walk every day. And I was not doing that before. I had a cane forever. I'm so much more mobile. I sleep better. My pain is not constant, and it's not in my face all the time. I can have fun. My sweetie I used to have so much nerve pain from my hip surgeries that wearing pants was painful. I mean, wearing underwear, buckling my seatbelt. I was like, man, if I could just have a job where I didn't have to wear pants.
But I can understand.
I wasn't that gifted.
So was that like nerve pain then? So you would feel it through all of the nerves, anywhere something would brush against that area?
Oh my God, it was horrible. And I mean, this went on for years. My sweetie, if he even like barely touched my leg, it would just set it all off, down my leg, up my back. So I will always be grateful that he always believed me. and he always tried very hard to accommodate. But during that time of trying to find answers, we couldn't even sit close to each other because I couldn't give the opportunity for anybody to touch my leg, or the nerve pain would just shoot off. Now I'll have a little flare up of nerve, I wouldn't say pain, but nerve discomfort, maybe a couple times a year. But I can wear pants and he can touch my leg.
A dramatic improvement.
Right, right. I mean, I can move, I can stretch. So yeah, I'll call it a win.
Yeah, absolutely. Are there any risks or limitations associated with regenerative medicine, and how do you address these concerns with patients?
So there is, I think, knowing that we still don't have a magic pill and a magic shot. The risks are generally just trying and hoping for a better outcome than you might have. So all the treatments that I do, I know very well how to do. So you won't come out worse than you are. I've spent a lot of time learning. We've done some international conferences so I could know what the rest of the world is doing. I also wanted to have interpretations of different countries' view on regenerative medicine. So I wanted to know, I still want to know more about how everybody does their treatments, what kind of outcomes they get. And I was very happy to know that the protocols that we have are very well put together and extremely well thought out, more than some of the other places that had given conferences about this. So I feel like doing my due diligence to make sure that I do a good service, I provide a good service for you, is really important. So I think the only risks that people would have would be if they were in my condition and wanted to be 100%. I did, I thought I would be 100%, and then come out about 65% and say, well, at least I can wear pants and my sweetie can love me.
Mm-hmm.
But I'm one of the difficult ones. Most people come up, at least 75% better.
And I'm sure you're not, saying, oh, I can 100% heal you from, whatever this is, but we're
Right.
sure going to try to make it better than it
Yeah.
was.
Yeah. And there's been, a handful of people that I have to work a lot harder to understand where the pain is coming from, or where the dysfunction, even if it's just general, physical, like fatigue and weight gain and anxiety, things that I might have to work a little bit harder to figure out because everybody's so different. But I suppose this is why we do all of the labs, to have a really good baseline, and all the images to have a really good baseline of where we're starting. So it can point to the most obvious way to go. And we always start with that. And then as we learn more, we might need to fine tune the path that we're on, maybe shift a little bit of direction. For me, it was also the same. I found out my body had so much environmental toxins that I was holding on to. And that was part of why I was having so much pain. So learning how to, detox from just everyday living
Mm-hmm.
was part of my regimen. Is that part of everybody else's? No, most people don't have all of the things that I went through to recover. A lot of people can just either start supplements to boost
Mm-hmm.
up their body, or do some, pain treatments, and they just take off and they're doing amazing. So there's always a handful of people though that make you think a little bit harder and make you look a little bit harder and read a little bit more and
Mm-hmm.
start going to conferences because of their situation to start asking more questions.
So what do you look at, like, emotional factors as well as childhood things that maybe we went through that we're holding on to in certain parts of our body, like trapped traumas? Is that something that
Oh,
you look at as well? Because I didn't know that some things that happen with my body are either trapped trauma triggers, Or like I started getting psoriasis real bad on my elbows. And then I started to remember, oh, I know what's going on. I was drinking green juice every morning because I love the energy. I love the way it made me feel. But too much of a good thing affects my body negatively. So I was having reactions to the high oxalates in like spinach and those green. And so they would come out of my skin almost like kidney stones. They would look like glass trying to come out through my skin. And as soon as I stopped drinking my green juice, it cleared up. But that was remembering.
Yes, oxalates are,
Go ahead.
no, I mean, to validate the oxalates, you're absolutely right. It's funny that we tell people to, eat your veggies and load up on spinach, and bananas are also high in oxalates, and tomatoes are high in oxalates. And those things, you're right, they do form kidney stones. They can form gallbladder stones. They can form little stones in our ears that cause vertigo. They implant in our muscles and our joints. It doesn't always cause gout, but it can turn into gout. So things that you're trying to do that are good for your body. So yes, I 100% agree. Those are little toxins that I also look for: mold, yeast, candida, fungal, oxalates. All of these things inhibit our mitochondrial, which is the powerhouse of regeneration of our cells, from turning things over. We can junk up our system if we're sensitive, right? That we're just not as hardy as somebody else's self-cleaning body is. And some people, most people, will need a little bit of detoxing one way or the other throughout life, because our bodies just collect air pollution, plastic pollution from our food, processed foods. If we don't have enough ventilation, then the chemicals that we preserve our floors and I clean our houses with. There's a handful of things we wash our clothes with. Not to make anybody feel paranoid, but
it's the truth.
I mean, these are things that you have to look at when people are starting to have problems, right? That you can't quite explain. Then you have to go, well, maybe you're just storing a lot of junk that we need to purge out of you.
Mm-hmm. Yeah.
But going back to the spiritual trauma, I think that you were talking about, I 100% believe about it too, like how you're like storing personal traumas and that turning and manifesting into other things. It's not something I treat, it's just not my gift. But I do know from personal experience that you need to find a way to treat it, because when you don't treat it, it also manifests into physical sicknesses. And so to have a complete healing, it takes sometimes a few years, right, to start chipping away at the layers and layers and layers of the causes, and for people to start learning how to listen to themselves, validate themselves, and heal.
Yeah, and that's something that I, learned through getting certified as a health and life coach. And for myself, because that's like a good portion of, like, I think 6 weeks of the schooling was on you, like learning to listen to yourself, listen to your body, go inward, because we're teaching people, or we're providing people tools for their toolbox, like meditation and breathing techniques, and like getting good sleep and nutrition. And those are all tools that I can provide to clients, but they are not things that will actually heal the whole person. They're just kind of tools that help people cope better with life, or have a better outlook, practicing mindfulness and gratitude and that kind of stuff. But if you're still holding on to, maybe trauma even from an accident, you don't realize how much of that you hold on to until the next time you hear that similar sound. Or you realize you're wincing because you look up and you see a car too close to your door, and you've been in an accident where, you've been struck on the side. Those are things that your body hangs on to. that, we have to work through, we have to learn to listen. And that, I think, is the beauty of, meditation. People say that prayer is when you're speaking to your higher source or your higher power or God or whatever, but meditation is learning to listen. And it's really learning to listen to our inner self. And
I
so,
agree.
yeah, so when I'll talk to people and I'll be like, okay, so you're having this pain, like we'll go into meditation. It's like, okay, where are you feeling that pain? And then we look at, the energies and chakras and try to do it outside of, you know, medicine, but it's still, we're energy, we're water, we're cells, we're, all those things.
I think I agree with you. I think one of the biggest sadnesses in just in medicine, is that we don't give the human spirit any credit and validate its existence, because we are such energetic beings. We're more than just a three-dimensional piece of flesh, with a brain that is existing today. So you're right, we're very complicated. And I do appreciate people like you who can see people to help them tap into their inner self. That hasn't been my gift, but I know it's on my list of things to learn. But I know from my own healing journey that I had to find many different people to help me unlock the many different traumas in my life, to understand how I can be actually just me, right? It's not even about making, this accomplishment or this, or setting this goal or this goal. It's just about being happy to be myself and validate my voice and my existence and love freely, but know when to have boundaries. All of these things
And
make
all
us
of these things
healthy
are so
humans.
so new to most of us, because it wasn't something that was, not to the most of the women that I know, it wasn't something that we were taught to do. We were either taught to be the homemaker, or if you're going to work outside the home, the best job, the best benefits to provide for our family. But there wasn't that education on self-care and boundaries and having a voice. That wasn't something I developed until I was 50. So it's only been a
Yeah,
couple of years that I've learned that I have a voice and how to use it.
it's true. I think many women have, it's more impressed upon us to have more of a martyr role in life than it is to have a strong established self. But the truth is, I feel like when we have the martyr role, right, we're doing everybody a disservice, including ourselves. We're not teaching anybody to be self-sufficient, self-reliable, to respect boundaries of each other, of themselves and each other, and to be mindful when you're over imposing in somebody else's happiness, right? Freedom, happiness,
Yeah.
ability to live. So I'm like, yay, go Leanne. Help us all find our voices. Men suffer the same. It's interesting. They have a different, it's like they hold it in a different way.
They absolutely do.
They're not allowed to voice their disenchantment, but they have a whole lot more freedom to be who they are. It's kind of interesting. It's kind of interesting to see. I probably didn't even explain it right for the men, but it's kind of interesting to see how both sexes aren't free to be who they want to be.
Mm-hmm.
And we're just learning why we should validate ourselves.
True enough. So what role does patient education and empowerment play in regenerative medicine?
Well, I love it when patients, I mean, honestly, people who come to see me, they've empowered themselves. They've decided that they are disenchanted with, the regular medical system. And just like me and you, they didn't believe that was the best they could be. So they went and started looking outside the box. And so most people come in here and have started to Google things already to validate their suspicion that there's actually something more going on.
Mm-hmm.
And I support them. I know people are like, oh, don't ask Dr. Google. And I'm like, ask them. You know?
Absolutely.
I say we all need to like start finding the information. I mean, the internet's so amazing. And if it's a little misguided, it's fine. Gives me an idea where you're headed, right? Sometimes people actually find the answer and they bring it to me, and I'm like, I have never heard of that.
Mm-hmm.
But now I got to learn about it. You
And I
know,
think
I
I
mean,
had kind of that situation where I was in trauma response and I was having extreme brain fog and memory loss, and it was extreme. Like I couldn't remember people I had worked with for 10 years. Like I couldn't put their name and their face and their life story together even enough to introduce them to somebody else because I couldn't even remember. I knew them, I knew the face, but that was it. And it was like I fought every day for a memory, for a thought, for something that I knew should exist, but I couldn't find it. It was like looking at blank Rolodex cards. And all I knew was that if this is my new normal, I need to find a way around it. I need to find a way to deal with it. But at the same time, I don't like it. So how can I make it better? So then I started focusing on, neurobiologists, neuroscientists, brain doctors, and what supplements were they recommending? And I found out, omega-3s is the number one brain supplement. And I had spent a lifetime of not eating fish because I don't like it, don't want it, don't nothing. And I didn't realize what a disservice and what damage I was doing to my own self because I didn't know that it was okay to just not have fish. Nobody had said, well, you need to start supplementing with something else. And as soon as I started supplementing with fish oil and krill oil, and learning different ways to improve my memory myself, like focused reading or just paying attention, making new memories, um, that I had to spend the time finding my way around and finding what worked for me. And, just 6 months in with those two supplements is like night and day. But now, is it the supplements or is it that I'm not in trauma response? Because
so
I do the meditation, I do the breathing techniques, life is different.
so it's probably a little bit of everything, honestly. I mean, trauma, shoot. There's a doctor here in town who opened a ketamine clinic, for trauma treatment, behavioral treatment, addiction treatments. And he did 30 years in the ER, and he was like, when I finished, I didn't realize how messed up I was. And so he went through a bunch of different modalities to try to heal, and that's what helped him heal, So he kind of like me, right? He found what worked for him, and for him it was like psychological and emotional. For me, it was everything.
Yeah.
But us ladies, it's we're designed differently. So usually our hormones start to leave us and start to fluctuate either after we had a second child or in our mid 30s. And so, and you think about all of our hormones, they do something very similar to each other. When you work in trauma, then your adrenal hormones will take a tank, right? Adrenaline, adrenal, they start to suffer. And when one hormone suffers, then it starts pulling from another one. So it might pull from your sex hormones. And all of our hormones, like I said, they do something very similar. People think like hormone replacement, oh, you need this. And I'm like, you don't need that. And many people don't necessarily qualify in my mind for actual hormone replacement when you can do things that support your hormones to help them come up. But our hormones are definitely part of our brain health and our heart health and our inflammatory health. But you're 1000% right, because before we even do hormone replacement, we go right to omega-3s, probiotics, B complex.
Probiotics, yep.
B complex, the B vitamins, not just B12, but all the B vitamins are like the building blocks for every cell in our body. So be complex, even if you're a strong meat eater, you know, I say take the vitamin Bs. If you're plant-based, take the vitamin Bs because they help preserve our cells. They help clean our organs. So it's like as we get older, all of these things, all these changes that we notice, it's because our body just needs help to keep maintaining our brain function, our heart function, our muscle function, our organ function. So you're right. Everything that you Googled saved your life. I feel like the Mediterranean diet is probably the best diet. Hands down, everybody will benefit from it. I don't like fish either, but I'll choke it down twice a week and take my omega-3 supplements because it's good for me.
That's good because I've actually got a client who is wanting more information on the Mediterranean diet. And I think a lot of it's those reasons. You know, we all just are learning to listen to our bodies and find what works for us and being able to say, okay, well, I really don't like the way this makes me feel. And that is, you know, finding somebody that's actually doing the time and the work and listening and yeah, not finding out the hard way. But for me, it was that. It was like, oh, look, I'm having this skin issue. Oh, I know why. I had forgot that years before I had had other skin issues for the same exact reason, those high oxalates. So, you know, I just had to remember that and go back and change that part of what I was doing. And sure enough, that took care of it, thankfully. But I had spent, you know, probably a month of slathering my elbows with, you know, oatmeal creams and then trying to keep them moist and just all these things. And it wasn't improving. It just felt like it was getting worse. And I'm like, well, that makes sense because I hadn't stopped doing anything either. So I'm learning to opt for more of the elimination diet before trying to treat topically.
You're right. So when it starts manifesting on the outside, it's because it already filled up on the inside, right? And that's true for, you know, environmental toxins as well as it is for emotions and mental health, right? And like when it's all filled up in here and it starts having outward manifestation, then it's time to start looking either inside the body or inside the mind, spirit, brain part, you know?
So one of the things you talked about was like traveling or attending other conferences. Is there other ways that you collaborate with other healthcare professionals to provide maybe comprehensive care for patients?
Yeah, so everywhere that we've gone, I've been fortunate enough to make connections with a couple of different other medical providers with strong backgrounds in different areas, and so it's nice that we kind of keep in touch. They'll ask me about things that they do for like pain and hormone stuff and regenerative, or how do I do this and how do I do that, and then I'll do the same for them. You know, what's nice is that most of the conferences that I go to, I try to go to hands-on conferences um, for hands-on learning and treatments. And so it's really kind of fun to see all the different, you know, walks of medicine that have just made medicine into an art. So I get to learn from them. And so it's very important to me to be able to call somebody who I don't know, you know, if I don't know the answer, so they can tell me their 2 cents, or they might point me to somebody else. But I also use the university here. We have a great consultation at the University of New Mexico Hospital. You can call them and they always have a specialist on call. And they'll usually call me back within a few hours when I have some questions. And that's, you know, a nice way to either validate that it was concerning or validate that it wasn't concerning, and to know if they feel like it needs to be addressed by a specialist, then I'm always happy to send them. But I'll be honest, about 90% of the time when I send someone to a specialist, they always turf them back to me. They didn't do anything different. So I gotta do the same thing. You know, I gotta start looking for a bigger reason and start looking for a better way to treat you, because that's why you're here, right? You believe you can be well, so I believe you too. Let's find a way to make you well. So
Wow.
I do have many different resources. It takes the world to keep me running.
And I think it does with a lot of us. And I think we're only stronger in what we can provide to our clients when we do have that kind of referral partnership or community connection with other people, where we can refer people out or just have the ability to reach out and say, hey, I'm having this issue, who, like a public forum type thing, who has seen this. And that's something that, as I mentioned to you, I'm trying to create within my community, is this like referral partner outlet, where we all kind of work together for the greater good, especially in the alternative medicine arena, um, because most everyone that is coming to me, just like people that are coming to you, they're kind of at that point where they're just like, I've tried everything and it's not working, or they're frustrated with the care they're receiving, or they just need that, they need someone to listen to them. And I think that's the biggest part, is people need validation. Um,
Yeah,
is
I agree. I I agree. They need to be validated with their human experience. You know, what they're going through is it's real. And I mean, I'm pretty honest with people if I've never seen it before, I'm like, well, I've never seen that before. But if
mhm,
you want to, I'll learn. And I think one of my reviews was so funny. One of my colleagues was like, well, is it a good review? Is it not a good review? I'm like, well, it was an honest review. And her review was, I came to her with this problem, and it's kind of a syndrome, meaning like in regular medicine, they don't necessarily believe it exists.
mhm,
And she told me about all the different types of people that she went to for help with this. And so I told her, I know about it. And this is what I know about it, is that
mhm,
regular medicine doesn't believe it exists, but here you are today. You believe it exists, so I believe it exists, but I've never done this. So if you want me to help you, I'm happy to start learning. It might just be slow
mhm.
because I've never seen this, in with someone in front of me. So in the review, she's like, she told me she didn't know what she was doing, and she was very honest about it. But she followed me down here, and at the end of the review, it's like, I feel better. So it was like a 5-star review. But you have to read through the whole thing. That makes me sound a little, I guess, incompetent. I thought it was sweet though. Like, to me, it's one of my favorite reviews. But it's funny because my colleagues are like, "Is that a good review? Is it not?" I'm like, "Look,
It's an
it was an
honest
honest
review.
review." Yeah, it was an honest review. I was honest with her, so she's sharing how honest I was, and it worked out well for the both of us. I got to learn a whole lot. She feels a whole lot better. And it is an ongoing issue that she has, but she's kind of like me. She's functioning at like 65%. Before, she was very functional, and I feel like teamwork, high five. She brought information to me. I had to figure out what I didn't know where to find it. She had been Googling late nights, right? Trying to figure out what was wrong with her.
Mhm,
So she did a lot of the legwork so it could put me in the right direction.
mhm. And that is so helpful too. Like you said, it's that empowerment, when
Yeah.
people become empowered enough to start seeking answers or seeking the help they need, and not necessarily accepting the status quo. Like, we have to go to the doctor for this, or we have to go to the doctor for that. We just have to accept, oh, your blood works great. See you next year. Um,
Oh
I'd
boy.
like a little more than that. So I'm sure I'm going to be next on your list.
I'm like, come in and see me. I'd love to help you.
Because I was very disappointed with making a change in primary care physicians to have the exact same behavior repeated with a brand new physician, even after voicing and explaining my frustration. Having gone to my primary care, seeking a referral for a therapist, and walking out with a prescription in hand for an antidepressant that I did not want and did not ask for. Um, and so at that point, I left that primary care, never took the med, found a new primary care, explained the whole situation. But I was already behind on like my annual and all that kind of stuff. So it was like, okay, jump on the table, let's get this done, and we'll talk about that after. And then again, I'm voicing my concern. Like, I told her, I said, all I wanted was a referral, and all I got was a prescription. And it was frustrating. And so, she didn't offer anything, and I didn't get my results from her. I received a phone call eventually from a nurse saying, "Oh, everything's great. We'll see you in a year." I'm like, but wait, like, I need a little more than this. I'm glad everything looks great, but obviously everything is not perfect. And I just wanted somebody to spend that time with me, and that's not going to happen. I'm not going to get that
Yeah.
in regular medicine.
But what's sad about that is that so much anxiety and depression also can come from nutritional imbalances, environmental toxins, hormone imbalances. I mean, so like we're quick to explain it away with here's your pill, you know, but I hardly ever write a prescription for anything anymore. Most of it is all supplements. So through all the blood work that I learned, I had a functional medical mentor. He was fantastic, or he is fantastic. When I worked in the ER, he was a patient of mine in the ER. He had a kidney stone, poor fella. He was so very kind. And I told him, I'm like, oh my God, one day I need to get out of here and start my own clinic. And he's like, oh, he's in pain, saying I'm actually a functional medical doctor. And if you ever wanted help, here's my information, call me and I'll help you start your practice. So years later, I called him and he remembered who I was.
Mm-hmm.
And he's kind of the one that started to show me functional medicine versus, insurance medicine that I've been doing. So he taught me to run all these labs, and he also taught me that there's actually optimal levels. So the same blood work that we have could be the same for somebody who's 5 years old to 105 years old. The normal range is still the same.
Mm-hmm.
But I don't want to feel 125, and I don't want to feel like a 5-year-old, right? Like you want to be in the optimal range, which is where we would be in like our, late 20s, early 30s.
Mm-hmm.
When our body's functioning the highest before it starts to have all of its issues. And so if it's within normal limits, he helped me learn that it's not within normal limits, that range is ridiculous. There's an optimal range for everything, for the vitamins, for inflammation, for our hormones, because if you look at the range, some of them it's like 10 to 200, and so they're telling you it's within normal limits. Well, depending on what the lab is, you're like, well, if it's 15, I'm pretty sure you feel like poop, right?
Mm-hmm.
And if it's closer to 200 or more, then I'm pretty sure you feel better, depending on which lab that we're on. And that started to make sense to me. So when, insurance medical providers call and say everything's within normal limits, it's misleading. I feel bad they don't know any better, because I didn't. I drank the Kool-Aid as well. And I had to undrink the Kool-Aid and go to the fountain of knowledge and wisdom. But it was part of me felt like I was betraying what I learned, right?
Mm-hmm.
Even though my body wasn't thriving with their guidelines, it still took me a while to apply what I was learning to myself. So it's kind of interesting. But this is like the disservice, because most people don't need an antidepressant. There are people who do.
Mm-hmm.
And
Absolutely.
so I do treat people with bipolar. I have some autism and OCD. And what I learned is they're more sensitive to environmental changes. Their mitochondria is not as sharp as most of ours. And this is probably why, processed foods and the environmental toxins building up in their system creates more more drastic highs and lows in them than it would somebody else, because their body isn't as able to ride the wave like some of us. They just need higher doses of like CoQ10, omega-3s, and Bs, things like that. And I had a patient that I was talking to about this. They're a scientist, and they used to live in Europe. They lived in Germany, and they told me, do you know that CoQ10 is a medication in Europe? they give high doses of this for mental health disorders. And I looked it up, and he was absolutely right. Back in the 60s, 70s, 80s, and early 90s, there is psychiatry documentation of giving doses up to like 24,000, 30,000 milligrams of
Oh
CoQ10.
my
It's like
goodness.
taking like 30 pills of CoQ10. I'm sure they make higher doses over there. But it's interesting to me that it all supports doing this for mental health disorders, and the literature is there, and it started to taper off in the late 90s and then the 2000s. I can't find any modern research on it. And to me, it just makes sense. Maybe pharmaceuticals got a little bit stronger. I'm not really sure. Maybe the direction in medical school focus shifted a little bit. Maybe the funding isn't there anymore. But we don't need to treat mental health only with just a pill. I feel like it's sorry, I think I went off on a tangent for you.
No, you're good.
Oh, but it's just so upsetting. It's so upsetting that, somebody like you can't be validated with, that I know that I am overwhelmed in life. Can I please have somebody to talk to? And they're
And
like,
that was it.
yep. You're like, here's a pill instead. How about you just go to Walgreens and talk to, Pharmacy Phil?
Mm-hmm. And that was the response. So here's a different question, and this is just because it's something that caught my attention recently. Was with regards to like medical research for all of these medications, was that they weren't being tested on us women for
So
from the beginning of time until, not too long ago.
that is very true. It is very disappointing. So you're right. Since they started doing research, whenever research started, I'm sure way back in the 12th century, whenever documentation started for health and wellness, honestly, they didn't use women because our bodies fluctuate because of our hormones. We're not a stable subject, right? So there's too many variables in a woman. So they tested everything out on men. And as a result, women are being treated as a result of male study, years and years of what worked for the men. And so us women have always been misunderstood, misdiagnosed, undersupported and undercared for. My grandmother, she had some pretty good mental health disorders, or mental health, how would I say this? Flares. She had been institutionalized a few times as my father was growing up. But to me, I think a lot of this, what like the unseen part of it, is that she was a very spirited woman, and she didn't have a voice, and they always just made her be quiet and behave. And so, as she got older, I only know her as somebody who was older, and she definitely had some, uh, temperaments, but I think to me, like I said, the bigger picture is probably she never had somebody to listen to her. She didn't want to do what she was doing. She didn't want to behave how they wanted her to behave. She had more voice and opinion, and you can see as she was older that she would stop herself from saying a lot of things, and it wasn't wrong. Whatever she was going to say, it wasn't wrong. It was just, I think she had just been silenced for so long. She could catch herself before she would get in trouble for it. And so she has passed, but I always feel like there's always, when I think about, like you said, the mistreatment of women, the misdiagnosis, the misunderstanding, I always think of her because I just feel she wasn't free to be herself. And I think, shoot, if I wasn't free to be myself, I would not be well either.
Exactly. It has taken me a lot of years to stop apologizing for everything,
Yeah.
because I spent a lifetime of being seen and not heard, or apologizing for entering a room while speaking and not realizing that maybe there were other people in the room. And I was always treated like, I was corrected. If you walked in the room like, "Hi, I'm home from school," and you didn't realize that there was company that might be sitting in the other room, it was like a pinch and you were pulled aside and, you were corrected. And so I spent a lifetime of apologizing for everything, the little things. It's like, "Oh, I'm sorry, I forgot to do this," or and it's like, God, stop apologizing. But it's a lifetime of things that we're having to change or learn that we can have a voice, and that we don't have to apologize for everything. So
And that we're all so different, and that's really cool, that we don't all have to agree, and when we find our voice, we have no idea what's going to come out.
and sometimes it's not what you're thinking, because I have that problem too.
Right. Right, it's like our Bambi legs with our voice, just trying to get a good feeling. And yeah, I think it's cool that this is an interesting, day and age. And I don't know if you have children or grandchildren, um but I do feel like anybody who has, young kiddos, it's going to be a really different world that they grew up in. I mean, they're probably going to be the ones that are perfecting the kind of medicine I'm, doing now. I mean, they're going to have a cold, and instead of, taking, ibuprofen and Tylenol and vitamin C, they're probably going to have some kind of, I don't know, little nasal squirts that just, you know,
Yep.
stops viruses dead in its tracks. And
We
if
can
they need
hope.
a new, right, if they need a new kidney, they're just going to print it out on their 3D printer. you know, it's going to be something where they don't have to use the kind of things that we've been using to get through life. And I think that they're all going to be more validated with their individuality and who they are. And I think it's kind of cool. I mean, like, wow, it's going to be very interesting to see how you guys come along in 20, 30 years.
Absolutely. I'm seeing that. I do have a grandson who's 6, so I see the future in his eyes. At the same time as I try not to see my own fear of his future in my eyes. Um,
It's true. Everything's got its own fine balance to work out, right?
Absolutely. Well, Jeannette, thank you so much. I am so glad we finally got this opportunity to sit down. There's so much value in this conversation. There are so many people who are seeking alternatives, and I'm honored to have met you and know all these different things that you do, that you can provide for people as alternatives, and most importantly, that you are holding space for people to be seen and heard and validated for their pains, their suffering, and that you are willing to, if you don't know, to learn. And so I appreciate that. Um, so where can people find you?
So we have a little clinic down here in the Nob Hill area, but you can always start by looking at the website. So the business is New Mexico Spirit of Wellness. The website is nmspiritofwellness.com. You can also email us at nmspiritofwellness@gmail.com. And you can call our office phone. The office phone also takes text messages. So you can call or text, and that's 505-726-4407. We're a pretty small, intimate clinic, so it's really just my sweetie and I who work here. So we're the only two that answer calls, and so we know everybody by name, we know everybody personally. Sometimes it takes us a few days to get back to you if you call and leave us a message or text us. But we will always find a way to get back to you if you're interested.
Wonderful. Again, thank you so much, Jeannette. I really appreciate our time. I appreciate everything you've shared with everyone. If you enjoyed this interview, please make sure you subscribe to my YouTube channel, Finding Resilience with Leanne. This podcast, Happiness on Tap, is available on YouTube, Spotify, Amazon Music, Audible, and Google Podcasts. For more information about me, please make sure you check out my website, findingresiliencewithleanne.com, all one word. Make sure you subscribe to my email tribe to receive exclusive promotions, new product service announcements, and upcoming events. And you can find me out on all the socials. So again, thank you so much, Jeannette. Everything, all your contact information, I included your TikTok and Instagram. So people will be able to find you. That information will be available in the show notes.
Thanks, Leanne. It's been a pleasure. You're such a wonderful person. I appreciate
Oh,
you too, sister.
thank you. You have a great afternoon.
You too. Bye.
Bye.